Kidney stones are hard mineral crystals that form in the urinary tract when substances like calcium, oxalates, uric acid, or cysteine become too concentrated in the urine. Main types: calcium oxalate, most common; uric acid from high purine or acidic urine; struvite, infection-related; cysteine, genetic or metabolic, rare but important in EDS. Why stones keep coming back in EDS plus adrenal failure? EDS, Ehlers Danlos Syndrome, EDS affects collagen and connective tissue, which includes the tissue in the kidneys, ureters, and bladder, leads to urine retention, reflux, and poor drainage. Urine sits longer, making it easier for crystals to form. Weak tissue, increased risk for infection and inflammation. Adrenal failure complications: low aldosterone equals poor sodium retention. Chronic dehydration equals concentrated urine, higher stone risk. Weakened immune response, increased recurrent infections. Amino acid imbalance, cysteine and arginine in EDS. EX may also involve a biochemical imbalance in how amino acids like cysteine and arginine are processed. What is cysteine? Cysteine is made from two cysteine molecules and is normally reabsorbed by the kidneys. In EDS, excess cysteine can occur, or kidneys may fail to reabsorb it efficiently. High cysteine formation of cysteine stones, especially in acidic or dehydrated urine. What is arginine? Arginine is an amino acid critical for healing and collagen synthesis. Nitric oxide production supports blood flow, immune and kidney health. People with EDS often have low arginine levels due to increased demand for tissue repair, disruption in amino acid transport. Why the imbalance matters. Cysteine and arginine share the same transport system in the kidneys. Too much cysteine or too little arginine overwhelms this system. Cysteine builds up in urine, crystal formation, cysteine stones. This hidden amino acid imbalance is a key reason why EDS patients may develop rare or stubborn kidney stones, even without the usual dietary triggers. Oxalates and other nutritional triggers. Oxalates are compounds found in many plants that bind to calcium and form calcium oxalate stones. High oxalate foods: spinach, beets, almonds, sweet potatoes, chocolate, tea. People with EDS and gut issues often absorb more oxalates, increasing stone risk. Why an animal-based diet may help. An animal-based diet, carnivore or low oxalate, may reduce or eliminate stone triggers. Zero oxalates supports amino acid balance, rich in arginine, taurine, glycine, bioavailable nutrition for kidney and adrenal support. Stable hydration and electrolyte intake, important for adrenal regulation, may help dissolve stones via citrate from lemon water or potassium citrate. How the stone cycle begins. 1. Weak tissue from EDS, poor urinary flow, retention. 2. Dehydration from adrenal failure, concentrated urine. 3. Excess cysteine or oxalates, crystal formation. 4. Crystals irritate tissue, stones trap bacteria. 5. Chronic infections, more inflammation, more stones. 6. Antibiotics can't fully eliminate bacteria inside stones. Cycle repeats until root causes are addressed. Prevention strategies: remove high oxalate foods, avoid excess calcium carbonate supplements like Tums, stay hydrated with salt, electrolytes, use potassium citrate or lemon juice to reduce crystal formation. Consider an animal-based, nutrient-dense diet rich in arginine and low in plant toxins. Get stones analyzed to determine type, oxalate, cysteine, etc. Final note: recurring kidney stones in EDS and adrenal failure aren't random. They're the result of structural, metabolic, and nutritional imbalances. Understanding the cysteine-arginine connection, along with proper hydration, diet, and stone type identification, is essential for long-term prevention and healing. Interstitial cystitis IC: what it is and how it makes kidney stones worse. What is interstitial cystitis? Interstitial cystitis IC, also called painful bladder syndrome, is a chronic condition that causes bladder pain, pressure, and frequent urination without a clear infection. It's not caused by bacteria, but by inflammation and damage to the bladder lining called the urothelium. Common IC symptoms: painful urination without infection, constant urgency to pee, pelvic pain or pressure, burning bladder sensation, pain worsens with certain foods or stress. Symptoms can mimic UTIs, but cultures come back negative. Why IC happens, especially in EDS. People with EDS are more prone to IC because their connective tissue is weak, bladder lining is stretchy and fragile. They often have autonomic dysfunction affecting bladder nerves. Their immune systems may be more prone to inflammatory responses. Over time, the bladder lining breaks down, allowing urine, which contains irritating chemicals like potassium, acids, and oxalates, to leak into the bladder wall. This triggers inflammation, pain, and a cycle of sensitivity that makes the whole urinary system hyperreactive. How IC makes kidney stones worse. Now, here's where it gets nasty. 1, inflamed bladder, amplified pain. A kidney stone trying to pass can irritate the bladder. If you already have IC, that irritation is like gasoline on fire. Pain becomes more intense, longer lasting, and harder to treat. 2, bladder inflammation can attract infections. Stones already raise the risk of UTIs. IC weakens the bladder's defense barrier. Together, they open the door for bacteria to invade and stick around, leads to chronic or recurring infections, worsening both IC and stone formation. 3, IC can limit treatment options. Many treatments for kidney stones, like potassium citrate, certain supplements, acidic drinks, can worsen IC symptoms. Even common foods that help prevent stones, like citrus, may cause pain in IC patients. This makes dietary management of stones more complicated. 4, hydration can be harder. People with IC often drink less because urination is painful, but less water, concentrated urine is more stones. It's a vicious cycle. Pain leads to dehydration. Dehydration causes more stones. Stones make IC worse. IC plus stones equals vicious loop. 1, IC inflames the bladder lining. 2, kidney stones pass, bladder is irritated even more. 3, pain increases, frequency worsens. 4, hydration drops. Urine becomes more acidic and concentrated. 5, more crystals form. 6, bladder pain worsens even without new stones. 7, repeated inflammation damages tissue further. Condition, what it does, impact on stones. Leak bladder healing, interstitial cystitis. Chronic bladder inflammation, burning and urgency. Makes stone pain worse, increases infection risk, EDS. Weak bladder tissue, poor healing. Increases IC likelihood, worsens inflammation. Stones IC double trouble, stones inflame bladder, bladder overreacts, more pain, more complications, less hydration. IC friendly stone prevention tips: avoid acidic or spicy foods, can trigger IC flares. Use alkaline mineral water for hydration, less irritating. Focus on low oxalate animal-based nutrition. Avoid potassium citrate unless IC symptoms are stable. Stay consistent with electrolytes, not just plain water. Work with a urologist familiar with IC and connective tissue disorders. Consider bladder healing nutrients. L-arginine helps bladder blood flow. Aloe vera, pure IC safe form. Collagen-rich bone broth for lining repair. Marshmallow root or slippery elm, soothing herbs if tolerated. Final note, interstitial cystitis doesn't cause kidney stones, but it makes the pain worse, the bladder more reactive, and the treatments more complicated. In EDS patients, it's especially common, and understanding this connection helps break the cycle of suffering and frustration.